When you talk about obesity, it used to be 1%, 2% of the population those days, maybe a few decades ago. Now it has come up to about 40% in the West, and in India it's about close to 20%, of which more than 5-6% of them are morbidly obese. That means they are more than 40 kilos overweight. We are supposed to have less lean mass and more fat mass. So we are prone for more obesity than the West with the same kind of a food style what we eat. Along with the carbohydrate based food, we are prone for fat storage more, causing obesity, and with kind of a genetic change what we have, we tend to have disease process much earlier than the Western population. To tackle this, we have to have a holistic approach in the sense we have to look into lifestyle changes to start with. Not only that, diet is playing a major role when it comes to obesity. We have to have a healthy balanced diet. Exercise is the biggest part of any weight loss when you wanted to hold on to the muscle but lose only the fat.
When you talk about lifestyle changes, you have to make sure that you have an activity in your normal life which can spend about 250 300 calories. For example, you walk up the steps and not take the lift home to the office. Another big advantage what you would have while working is don't sit all the time. You get up, go for a small water thing, you go there instead of asking people to bring it. You go to the next table instead of using intercom. You go to work, go to bathroom, you can do some sit-ups, do some kind of activity. And again, try to be more mobile as possible. Make sure around 10 to 15,000 steps is done in a day. That is the kind of a lifestyle talking about. Again, increase your outdoor activities as well, like going for a cycling or going for a swim. It's not exactly a sports, it's exactly an increase in lifestyle, and this will help you along with diet and exercise to lose weight immensely and to maintain it.
When it comes to diet, it is very difficult to really understand what we are trying to achieve here. Our achievement in Indian scenario is try to reduce carbohydrates, reduce fat, and increase your proteins. That's basically because Indians have less lean mass, so we need to make more proteinaceous food, as well as we store more fat, so we reduce the carbohydrates, which is converted to fat if we eat more. So it has to be a balanced meal, at the same time more proteinaceous, less carbs and less fat. And the most important thing is we have to eat at regular intervals. A breakfast should not be skipped, it should be a full meal. Lunch has to be half, if possible, bit more. But dinner has to be before 8 p.m. and it has to be half stomach, because if you eat more, you start storing more, because beyond 8 p.m. metabolism shuts down. That is pretty mandatory. Apart from that, avoid having snacks unnecessarily, because we are prone to put on more weight if you eat 3 full meals. We have to have 2 good meals, rest all has to be half meals. That is pretty important.
When it comes to exercise, it is about how smart you are exercising and not how tough you are exercising. Talking about weight loss, cardio is the best exercise to do for weight loss. That is, if you lose fat. But the problem with that is, you lose fat, but along with it, you lose your muscle as well. But you have to hold on to the muscle for us to build some good muscle, as well as to have the protein stuffs inside, so the lean mass is good enough. For that, better to have a high intensity interval training, which is pretty good to do. And when we talk about high intensity training, it has to be with some weights as well. If you do that, you hold on to the muscle well and you lose the fat. So a mix of cardio and high intensity training is the way to go about when it comes to fitness.
There are times when we need medical help, and of course we should understand our obesity. Some are overnourished, some are having hormonal issues, some are having genetic issues, some are having some disease process which increases obesity, some are on medications which causes obesity. Everything has to be understood, and accordingly patient has to be treated. That is why having a professional help is very important in these kind of situations. And of course, if scientifically followed, not a single person can hold on to obesity all the time. They can lose weight and be healthy with a very good improved quality of life. So what I would like to say this Obesity Day is, we all have to pledge towards a obese free life, and at Apollo we strive to make sure we give the best in achieving that. Jai Hind.